Assalamu alaikum.
Walaikum
Walaikum salam.
salam.
In the last class, we finished neurodegenerative disease here. Let's start anxiety, anti anxiety. That's what is problem inside the brain in an anxiety? Inside frontal lobe, overexcitation. How patient present with anxiety. And in anxiety, the patient having suppressed worries. The person anxious person. Yeah, can have not well thinking process is also disturbed. Anxious person can't planning also disturbed. Okay, so it's anxious person for an anxiety. If you have any type of stimulus, like you having stress or fear, any type of stress or fear from your like family side, parents, from your friend side, from society, any type of stress. If that stress make you fear, make you worry, that is not an anxiety. Very simple example. As being student, you have exam after 4 5 days, exam after 1 week. So these 4 5 days or 1 week of syllabus, too many books to read, very lengthy. You have to prepare all the books, all subjects. So during that exam time, which student feeling stress. But when exam, the last moment when you submit your final paper, that time, just after that last minute when you submit your exam final paper, you're feeling very happy. Yeah. So this means when exam finish, so No one in anxiety. Yeah. So no more stress, no more. It's not an anxiety. An anxiety is not a real definition of an anxiety. Without any type of stress, the patient still worry every time, worry about all decisions in the life. Okay, to make a plan, to thinking about something, about the occupation, about his or her job, about his or her study life. Okay, without any type of stress, that's an anxiety. If patient worry always without any type of stress, if have stress, automatically you worry. Yeah. Like you have big loss in your family, trouble now, you worry, you're anxious now, like this. Yeah, understand? So when if you remove the stress, anxiety finished. So so that is not real anxiety. Anxiety, overstimulation inside the frontal brain. So this anxiety is a neurotransmitter issue now. This anxiety stands for month. Per month, the patient having worries and fear till month have any type of stress? No stress. Without without any stress. Now this problem now, the patient worries for months and have any stress? No stress. Without any stress. That's an anxiety. Clear? So this anti-anxiety, first we give the name to this anti-anxiety drug. Anti-anxiety drug make you calm, make you peaceful, peace, give you peace, peacefulness inside your mind, okay? Make you calm. So this effect, if any drug give calming effect, it's known as tranquilizer. Tranquilizer. Clear? Tranquilizer. What is tranquilizer? Any drug give you calming effect, okay? Give you calmness. So that's a tranquilizer. Anti-anxiety drug known as minor tranquilizer, because an anxiety is the issue of month, weeks to month, weeks till month. Okay. So in opposite to an anxiety, you having another big problem. An anxiety is not a big problem. Psychosis is a really big problem. Okay. Psychosis is a really big problem. Psychosis start from month and until years. It's a very big problem here. The patient totally discomfort, full life disturbed. So if any drug solve this problem, that's also tranquilizer, because this problem is not a small problem, it's a very big problem. So tranquilizer, major. Understand? Antipsychotics are major tranquilizer. Not mix these drug name, okay? Totally different. Antipsychotics are Antipsychotics are these are major tranquilizer. How about the minor tranquilizer? Minor tranquilizer. These are anti-anxiety drugs. Understand? Anti-anxiety. So these major tranquilizer, these drugs actually work against dopamine. Yeah? Antipsychotics are anti-dopamine. How about these drugs? These drugs work for they stimulate GABA. So you can see the very big difference between these two groups. Not mix these two groups. Okay, it's not meaning major tranquilizer having long name and minor tranquilizer having short name. Not like this. Okay, totally different group. Minor tranquilizer for an anxiety, major tranquilizer for psychosis. Okay, anxiety is not a big deal if you compare with psychosis. Psychosis is a big problem, big psychiatric illness, psychosis. Okay, and anxiety is a small issue. Anti-anxiety drugs are minor tranquilizers. Now we move on. Next, minor tranquilizer. Now this name clear? Why you call these drugs tranquilizer? They give you calming effect. They give you calming effect. They create peacefulness inside brain. Okay, give you calming effect. No more excessive stimulation. No more worries. Patient no more anxious. Okay, minor tranquilizer. Minor tranquilizer. These are anti-anxiety. Another name. These drugs they also known as because they're producing sleep, so they sedate the patient. These also known as sedatives. Sedatives also create a one condition like sleep but not sleep. Hypnotics. Sedatives, hypnotics. Sedative, hypnotics. These drugs they also make patient sedate. Okay, these drugs also known as sedative and hypnotic. Minor tranquilizer, anti-anxiety, sedatives and hypnotics. Understand? Minor tranquilizer, same name. Anti-anxiety drug, same name. Sedative, hypnotic, same group. So what are these drugs? These drugs working on GABA. These drugs are GABA agonist. Clear? Now, next, move on. The types of drugs. First group, barbiturate. Second group, benzodiazepines. Benzodiazepines and barbiturates. Barbiturate. Okay, first we create the difference between these. What are the differences between these? This drug was older one used for an anxiety. This drug was now new one. These drugs are not barbiturate, not much safe. These are very safe drugs. Okay? Barbiturates, how they work. These drugs not need not need GABA neurotransmitter for working. Benzodiazepine. These drugs need presence of GABA neurotransmitter for its working. First action, this mechanism action is different. Okay, both drugs going to same receptor. Both drugs going for GABA receptor. GABA receptor. Okay, both drug going for GABA receptor, but this drug barbiturate they directly attach with GABA receptor and no need GABA presence. Okay, no need directly attach with GABA receptor and no need GABA that neurotransmitter presence. But this drug need presence. This drug also now GABA also attached with receptor and same time benzodiazepine also attached with it. Without the attachment of GABA, this drug not work. Okay, this drug barbiturate unsafe need not need GABA. Third, very easy for toxicity. Very easily for toxicity in case of overdose. Overdose can lead to toxicity, but this drug, benzodiazepine, less toxic, like overdose, not producing very strong effect like barbiturate. Okay, less toxic if overdose. This drug very toxic for overdose in case of overdose. Number four, not have antidote. Not have. We not having antidote if overdose. Overdose can lead to death. No antidote. Benzodiazepine have antidote. We have antidote. That then antidote in case of overdose to make it reverse. The name of that antidote drug, flumazenil. Flu Flumazenil is the antidote for benzodiazepine. If accidentally giving benzodiazepine overdose, to reverse it, give flumazenil. But in case of barbiturate, so that's why these drugs are unsafe. These drugs are more safer. Okay, these drugs are more safer, not going like in case of overdose, not much toxic as compared to barbiturate. Now first we start barbiturates. What are the name of barbiturates? The first one, thiopental. 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 Thiopentene. Same thing. Pental or pentene. Next one, amobarbitol. Cipobarbitol. Amobarbitol. Cipobarbitol. Third one, phenobarbital. Phenobarbi. Phenobarbital and pentobarbital. Okay, so this one short action, this one intermediate, this one long action. Okay, these two drugs long action. Thiopentol very short action, very short acting. This drug acts very rapidly. Okay, thiopental and thiopentine. Amobarbitol, cicobarb is moderate. Okay, not longer, not long acting, not much short acting, intermediate action. Amobarbitol and cicobarbital. Amobarbitol and cicobarbital. Clear, clear? Name clear? So what are the uses of these drugs? Amobarbitol, cicobarbital is used to sedate the patient. Used for an anxiety, used for an anxiety. If patient having issue insomnia, okay, patient having issue insomnia, the patient having issue like sedation, one issue, an anxiety, used for an anxiety, used for insomnia. We also use for anesthesia. Anesthesia. We also use to relax muscle relaxant, muscle relaxant. Muscle relaxant when the patient having brain stroke or spastic muscle. Can use this drug to relax muscle. Muscle relaxant, anesthesia and anxiety, insomnia. Another use hemolytic for hemolytic anemia induced jaundice. Especially we use for jaundice. Okay. Now we come one by one. These drugs. So what are they nowadays? In recent days, these days, we using these drugs, they producing a lot of side effects. We just use in anesthesia. This use still here. We use for jaundice. This use still here. For insomnia, for an anxiety, we having benzodiazepine, very safe, not much toxic, having antidote. These drugs have no more use for an anxiety, have no more use for insomnia. Okay, we can use these drugs for insomnia and anxiety, but in case of overdose, it may be life threatening. Understand? If in case of overdose, it may be life threatening. So, an anxiety and insomnia purpose, we are not using these drugs. For anesthesia purpose, so what's the meaning of anesthesia? Which drug we prefer? For anesthesia purpose, induction of anesthesia. It's very important use. Induction of anesthesia. Induction of anesthesia. By first we give before we make anesthetize the patient giving general anesthesia, we're using very common question. Thiopentol is still using for induction of anesthesia. Thiopentol and Pantene, okay, same name. Thiopentol and Pantene still using for anesthesia induction. Starting anesthesia with thiopentol, okay, very short acting. It make the patient sedate very quickly. Make the patient sedate very quickly. We giving IV injection, intravenous injection of thiopentol to sedate the patient before giving other medication. Okay. So induction of anesthesia. Second, very important use. This drug, newborn, if newborn having jaundice, newborn having jaundice in newborn. Jaundice in newborn, the newborn baby, infant, neonate having jaundice. Why they having jaundice? Mother blood group and baby blood group are not same. Yeah, mother negative and fetal positive. So what they develop? Erythroblastosis fetalis. Erythroblastosis fetalis. More lysis of iris. Lysis of iris. So red blood cell releasing what? Heme. Heme change to bilirubin. Okay. So this bilirubin going high. Which bilirubin? Unconjugated. Conjugation in liver. Okay. Unconjugated high. Because now the baby having got hemolytic anemia. Not only in babies, we also can use in other adult person if having hemolytic anemia to treat jaundice. Okay, for treatment of jaundice, we're using this group of drug. Why? This unconjugated bilirubin change to conjugated one. We're using one system P450 system. This P450 system present in liver. P450 system having two reactions, phase 1 and phase 2. Two reactions. This is the first beginning of pharmacology in metabolism part. The phase 1 hydroxylation, redox reaction, okay, In phase 2, we're having acetylation and especially conjugation in phase 2. Conjugation. In phase 2, which reaction? Conjugation. So conjugation of unconjugated bilirubin to conjugated bilirubin, so it needs P450 system. So all this reaction inside the liver, okay? Inside liver. Clear? So these drugs like pentobarbital, phenol, long acting, okay? These drugs, the pentobarbital, phenobarbital, especially pentobarbital, keep in mind this pentobarbital, this drug stimulates this P450 system. Pentobarbital stimulate all the CNS acting drugs, many CNS acting drugs, they stimulate P450 system. The GIT drug and antifungal drug, they block the P450 system. P450 system. Stimulate P450 system. Then what happened? Phase 2 reaction. 2. Phase 2 reaction increase. When phase 2 reaction increase, what happen? Unconjugated bilirubin rapidly change to conjugated bilirubin. Understand? Unconjugated bilirubin change to conjugated bilirubin. So we're using for this drug pentobarbital. We use for jaundice in newborn. Jaundice in newborn, especially if like simple wording. So we use for if the patient, any patient, adult or baby having hemolytic anemia. Hemolytic anemia. Hemolytic anemia lead to which bilirubin high? Unconjugated bilirubin. Unconjugated bilirubin high. Need to change to conjugated bilirubin. So here we having B450 system. So now B450 system is stimulated by pentobarbital. Pentobarbital P450 system. Pentobarbital stimulates this P450 system. Clear? And stimulation, conjugation increase. Now jaundice gone. Jaundice treated. Understand? So it's a very important use of pentobarbital. Pentobarbital we use for hemolytic anemia induced jaundice. With jaundice, unconjugated bilirubin. Very clear? Unconjugated bilirubin. So another use, use number 3. I already explained we can use for an anxiety. These drugs are very toxic and anxiety is not a big problem. Insomnia is not a big problem yet. So we can use benzodiazepines safely. These drugs can be used for anxiety, can be used for insomnia, but if, for example, the patient take 2-3 tablet extra or overdose in the patient, then it may be life-threatening for that patient. Understand? So these drugs are not much safer in insomnia patient or an anxiety patient. Understand? Because another problem in emergency, you also not having antidote for this drug. If time too longer, patient attempt for suicide and lot of pills of benzobarbiturate, then maybe little chance for a second life. Understand? So we can use, but must prefer benzodiazepine. Must keep in mind, okay? Not go for this barbiturate, but still older one. When there was no benzodiazepine, we only have barbiturate. We only have that. Barbiturate was older GABA drugs. New one, new one we have benzodiazepine, more safer. Use number 4. We use for seizure. We use for seizures like simple epilepsy. We use for epilepsy. When epilepsy is not controlled by, for epilepsy we use sodium blocker, we use calcium blocker, we use glutamic acid blocker, all these receptor blocker. When epilepsy is not controlled by these drugs, to control the attack of epilepsy, we having GABA drug. Benzodiazepine, we also prefer for seizure. Barbiturate, we also prefer for seizure. Which one more safer? Benzodiazepine more safer. Okay. Which one more safe to use? Benzodiazepine more safe to use. So we use for seizure in case of epilepsy. In case of epilepsy, you can use these benzodiazepine. Which one? Long acting pentofenone. Okay. For an anxiety purpose, you can use which of following drug from barbiturate for an anxiety person. This we use for hyopental can be used for insomnia, okay, because very short acting. For an anxiety, for insomnia, you can use MO and CCO. These are just intermediate action, but these drugs can be more toxic if in case of overdose. That's why we will not prefer these drugs over benzodiazepine. Understand? So not go for Pento and Fino, okay? For an anxiety purpose, we not use Pento and Fino because these are long acting. It's very long acting. If you take Pento or Fino patient, the person remains sleep for 1 day, 2 day like this. It's very long action. It's very long action, yeah. So for insomnia, for anxiety, if you want to use thiopentol or amobarbitol, not go for this. Thiopentol we can use for anxiety, we can use for insomnia. Amobarbitol, cicobarbital also can use for anxiety or insomnia, okay? Because a bit short duration of action. Phenobarbital, pentobarbital, not preferred for this purpose. Phenobarbital and pentobarbital we use for jaundice one, another seizure. And use number five. Use number five if the patient having spastic paralysis. Patient having spastic paralysis. Spastic paralysis. So if spastic paralysis, like in case of stroke, in case of, if you remember, tetanus, spastic paralysis and tetany also, okay? So you can use these drugs to relax the muscle for spastic paralysis. Fast, very strong contraction. If you use this drug, no more current to muscle, muscle relax, okay? For spastic paralysis, the five uses. From these five, anxiety, insomnia. The first thing, the prefer benzodiazepine. For an anxiety, for insomnia, prefer benzodiazepine. So nowadays, these drugs used for hemolytic anemia induced jaundice, especially if the mother and the baby blood group not same, the more chance for development of erythroblastosis fetalis, neonatal jaundice. This is one cause of neonatal jaundice. Another cause is Gilbert syndrome. Another cause is Siegler-Najjar syndrome. Many syndromes there. Rotor syndrome, Durbin-Johnson syndrome, lot of syndrome causing neonatal jaundice. Okay. In the case of neonatal jaundice, neonatal jaundice, you can, if unconjugated, okay. In Gilbert and Siegler-Najjar, unconjugated jaundice, you can treat by using pentobarbital. You can use pentobarbital. Another use nowadays still we using for induction of anesthesia. These two uses common. Okay. For other use for seizure, for muscle spastic muscle paralysis to relax the muscle. Okay, clear. For insomnia, for anxiety. The other uses we, the first we prefer benzo. First we prefer benzo. Then you can come for this. Only these two uses. We prefer barbiturate. Okay, for for induction of anesthesia, for for jaundice, we use these two drugs. Clear, clear. For other uses, for seizure, for muscle paralysis, for anxiety, for insomnia. The other uses, our first priority must be second group, benzodiazepine. Now come to benzodiazepine. Before going to benzodiazepine, we try to understand why these drugs are not much safer. See the graph here. This side is the dose, okay? This side is your consciousness, brain activity, consciousness. For example, now you're fully awake, you're fully conscious, your brain, for example, is 100% working, you are conscious, okay? So if you add, if here is 0 here, if you add some drugs, these drugs are GABA drug, yeah? So how GABA working? GABA working by putting coloride inside this, you know, by putting coloride. And what happens when you put coloride inside? Hyperpolarization. Clear? Now, if here 1 mg, 2 mg, 3 mg, this is just a dose 1, 2, 3, 4, 5. If you increasing dose this way, so what happened here? Your consciousness is
Sorry,
decreasing. Your consciousness is decreasing. Understand? Your consciousness is decreasing. Then, if you increase more dose, more decrease. Increase more dose, more decrease. Increase more dose, more decrease. Till here. Now it's a 0% conscious. Yeah, you fall down. Here is a death. Before death, here is the coma. Before coma, here is anesthesia. Before anesthesia, here is sleep, sedation. Before sedation, here is your anxiety line. Let's start, restart from meeting.
okay, sir. We start.